Hello, I'm Smriti. I'm a special educator and a counseling psychologist. I'm doing this video as a part of Autism Awareness. April 2nd is World Autism Awareness Day, and April is Autism Awareness Month. Autism is a complex neurological disorder, it is a brain developmental disorder. It is a disorder, it is not a disease to cure. This is the first thing we have to understand about autism. It is not a disease, it is a disorder. I heard the word autism in my life when my younger son diagnosed with autism. It was 12 years ago. At that time, my knowledge about autism was zero, and I thought it is a disease, and I have to try different treatment methods to cure it. So, like that, I started my journey. But from my experience and after completing the special education course, I understood that it is not a disease to treat, it is a disorder. There are some differences in these children, but they can also learn, they can also understand, we can build various skills for these children. They may perform in a different way, but they are also capable of doing all things like us. They have some struggles, but they have some skills also in them. We have to train them to develop all that skills. So that was my understanding. So I would like to share some information about autism. So in when a child between the age 1 and 2 years, we may notice that the speech is not developing properly. Child is not communicating by using their point fingers for pointing. The child is not imitating what is happening around. Child is not showing interest with other children or with other people. They may be playing in a different way by arranging their things in a different way, and sometimes they will start crying, and we may not be able to find why the child is not while the child is crying, and they may cry for a long time continuously, and we can't find what is the problem at that time. And the joint attention, when we are pointing to a place and asking the child to look at there, the child may not be able to look into that point. So these are some early symptoms that we will notice. And if we are noticing all is any of these symptoms, you can first consult with your pediatrician. Then if the pediatrician also finding the name, will try the name call, if the child is responding to name call and all. If there is something missing, then it's better to go and meet a developmental pediatrician or a psychiatrist or a neurologist. They are the people who can do a proper assessment to rule out your child is coming under ASD or not. ASD is autism spectrum disorder. So it is a spectrum disorder. Here each child will be different. Each child has their own struggles, their own difficulties, and their own strengths too. So mainly autism is affecting a child's ability to communicate, ability to interact with the people, and they may show some repetitive behaviors like hand flapping, toe walk, turning continuously, or they seek lots, some sort of movements with eyes, and some odd behaviors they may occupy. So these are the triads of autism. So mainly it is affecting a child's ability to communicate. So when first after the diagnosis, of course the parents need the proper training to understand about autism, to then only they can understand their child's needs to get different therapies, how to plan the proper early intervention program. So the parents should go through the proper training programs to understand this, and after understanding it, they can start the early intervention program between 2 to 7 years. And when the child reaches 7 years, we will be able to understand. By that time we will give different exposure to the child regarding academics, art, music, dance. sports activities, all these we will give that exposure to the child. So when the child is completing 7 years, 8 years, by that time we can understand that this child is showing good interest with this particular, this child has great difficulty with this. So for example, a child may be showing good interest with art, but the child is struggling to do academics. So we will focus art as a medium to teach him academics also, and we will plan how the child can improve in terms of art, what all the skills that related to art we can give to the child, and how we can encourage the child to do work more on this. And at the same time we can introduce some functional academics to the child that will help them to lead an independent life, and we can focus into their strength also. So this way we will plan the future for the child. So some children will be good in academics, some children will be good with sports, some children will be good with art. So each child can do something, that each child is good at something. Each child has their own difficulties too. So the difficulties, if that area is important in their independent life, of course we have to work on that, in simple step, at the same time by focusing into their strength, so that they will be happily occupied with the program what we are providing. So children who can do well with academics can move to an inclusive school where they know how to handle these children, or they can try NIOS. So that option will go like that. But children who have different other abilities in other areas, that we will focus, and with that we will provide the functional academics to teach the child. So this way is the training programs that is going on for children with autism. In the society, there is a misunderstanding that if a child is diagnosed with autism in a family, that is a very bad thing happened in the family. That is a misunderstanding. I don't know why people are thinking like that. We all are different in our own way. We all have some good character, some good qualities, and of course there are some bad qualities also. And when a child is getting a diagnosis, please don't look into that label at autism, autistic. Please don't look into that label. Yes, label. Yes, this child is different. He is learning in a different way. He is responding in a different way. He is communicating in a different way. But he can do all these things. We have to appreciate that, we have to encourage that, and instead of keeping them separate, keep that child also with you, and keep that mother also with you. Don't try to give the impression that it's all happened because of the bad parenting, it's all happened because of the bad training. No, autism is a brain developmental disorder. These changes are because of the brain developmental disorder. It's not because of the bad parenting. It's not because of the environmental factors. So please don't blame that mothers. Please don't uh, please don't hurt them by giving all this. So that mother may be struggling to give the correct support to that child, to give the correct training program to the child, because it's not easy to train a child who has autism. A mother should work from morning to night with lots of patience, with lots of love, to teach all the various skills that they have to learn. And because they are not observing how the other people are, we all are learning by observing our parents. So we learn to talk by observing our parents, we learn to do household things by observing our parents. But these children, because of the lack of imitation skills, they may not learn all these things by looking into others. So we have to take each skill, we have to work on each skill, and we have to train our children to learn to eat, to learn to take bath, to learn to dress, to learn to sleep alone. So for all these things we have to work other than academics and things. So there are so many areas a parent is focusing. So there in each family we are sharing the responsibilities between the father, mother, and sibling, and we are satisfying the need of the child, and we are moving forward. So if you are seeing a family like that, and don't keep them separately. You have to include them in your friend circle, in your family circle, and accept that child the way how the child is. If you have started asking about why your child is doing this, why your child is not sitting, why your child is not talking, please don't ask these type of questions. You have to understand that each child is different like us. They have some difference in their behaviors, they have some difference in their communication skills. There are people like this. You have to understand that, and you have to accept the child the way how he is. The families need that support. And for mothers also, don't get depressed. Don't think that why it happened to me. Don't think that it's something bad happened in your life. Like other children, these children also have some their own particular need and all. We have to address it in a different way. But you have your own life, you have your own interest, you can focus all that things in that way. And at the same time, give the proper training and the intervention that your child need. The early intervention program, and then the plan the pre-vocational program, vocational program, NIOS, or anything that is suitable for your child, and move forward. And don't bother about what other people think about your child, what other people talks about your child. We all are trying to build awareness in the society by spreading messages like this, so that they all can understand about autism, about our children. And if it starts from us, if you are ready to accept your child the way how he is, and if you are happy with that, of course society will also encourage you, society will also welcome you. So it starts from you. And in my case, my yes, autism is an autism spectrum disorder. Here there are some children who are mildly affected, who are severely affected, or moderately affected. My son was severely affected by the age of 3 years. And he was rejected from the most famous early intervention centers in Bangalore by telling that he is a very difficult child to handle. So that is why I was thinking about doing the course to help my son, because there are people who are complaining about him. They are not ready to give me the proper training. And also I did the course, I completed the course, and I started helping my son. And at the same time, I started helping other children and other families. So like this I started my journey. So, and my son is non-verbal. He can use very minimal words, but he can communicate using an app called Avas. He can communicate using pics. He can communicate using gestures, and he can use some his words also. So he has excellent communication skills to express his needs, to express his feelings, to express his difficulties, to express his desires. He can interact with the people. All that things is possible. He is not able to write, but he can type nicely. And he even though he is not able to read loudly, he can read in mind, he can answer the question, he can learn the lessons. He has very good comprehension skills. He can't do mental max, but he can do calculations using calculator. He can do word problems. He can do functional use of money. He can read the clock. And he can do data entry. He can do various computer related skills using mouse. And he is excellent in jewelry making. He has a jewelry making unit, and he has customers across the globe. And he is doing beautiful embroidery works. And he because he was hyperactive, I was focusing into sports. First he learned cycling, and then he learned skating. He won so many gold medals in state level, gold medals and silver medals in state level for roller skating. He participated in Special Olympics Bharat. The Special Olympic awarded him as a special athlete. And he is very good in swimming, badminton, basketball, all these he learned, and he is occupied with all these activities. So think about him. He was in the severe end of the spectrum, and he was rejected from most of the famous centers. And we came a long way after that. So all our children can learn and can improve and can lead an independent life with some support. We all are trying for that, and as a parent we need support from you all and understanding from you all to accept these children, to include them in the society, and to help them to become a productive member in the society. So this video, all the people who are watching this video, please try to understand about the points that I am discussing in this video, and thank you so much for listening.